Tuberculosis, often known as TB, is a potentially severe infectious disease that primarily affects the lungs, caused by a bacterium. It can spread through lymph nodes and bloodstream to all parts of your body. An interesting fact is that most people who are exposed to the TB germ do not show any symptoms at all. This is because the germ can live dormant or latent in the body for a long period of time. But if the immune system is weakened, the germ becomes active and can cause damage and death of the tissues of the organ it attacks. This is known as active tuberculosis, a deadly and highly contagious disease if not treated appropriately. Finally, we have multi-drug-resistant tuberculosis. It's a form of TB that is resistant to all known drugs. Although TB was considered eradicated 2 decades ago, this form of TB has emerged, posing a new challenge to healthcare. Tuberculosis, commonly known as TB, is a contagious disease caused by a bacterium. Surprisingly, a majority of people who are exposed to this bacterium do not display any symptoms. Symptoms of active TB are similar to other respiratory tract infections and include general malaise, cough with phlegm, and fever. Tuberculosis is transmitted through the air, making it highly contagious. However, transmission doesn't occur from a single encounter, but requires prolonged exposure. Complications from TB can include spinal pain, joint damage, meningitis, liver or kidney problems, and heart disorders. Diagnosis of TB can be done through a skin or blood test, followed by further tests like chest X-ray and sputum sample, if required. Tuberculosis, a deadly disease, can however be cured. The treatment usually involves several medications taken over a prolonged period, typically 6 to 9 months. The U.S. Food and Drug Administration has approved 10 drugs for the treatment of tuberculosis, primarily. The first line of these agents include isoniazid, rifampin, ethambutol, and pyrazinamide. Preventing tuberculosis also plays a key role. This can be achieved by taking all your medications as prescribed, keeping all your doctor's appointments, covering your mouth when coughing or sneezing, and washing your hands afterwards.